Hi guys. So I don't have access to a lady to talk to right now, and I tried to convince my husband to help me out, and he kind of didn't want to. So I'm just going to kind of lay out a scenario and go according to that. So for this video, then I have a mom who she's a first time mom. She's never breastfed, but she's curious to learn about it, and she's curious to learn how to pump to store her breast milk so that when there are times when she would like to go out on a date or she's not able to be with the baby because let's say she's a birth worker, then this this video will help go over the importance of breastfeeding, how to do it successfully, and also how to pump and express milk. So the first thing that I would do is I would give her these handouts that I created in my breastfeeding class. I'll show them to you really quick, and then I will also upload the links. So here's the first page of the getting it off to a good start, and then there's a second page, and then here's the importance of breastfeeding. And then here's a handout on expression and storage of breast milk. It goes into every single part of expressing, like how to choose a pump, and how to freeze it, how to store it, how to warm it up, how long you can freeze and store everything. And then I also have a video that will show how to manually express it. That it's one that I've used before and it's worked really well for me. So now I'll treat you like my client. So hi, I'm very glad that you're interested in learning about breastfeeding. One of the things that I wanted to make sure you knew was how important it is that it lowers the risks for the baby to have asthma, for them to have diarrhea and vomiting, respiratory distress, or respiratory infections, SIDs, so SIDS, any allergies. They're less likely to be obese or have sicknesses or get type 2 diabetes or cancer. For the mom, it lowers her risk of type 2 diabetes and breast cancer, along with also ovarian and uterine cancer, and it decreases the chance of postpartum depression. And something that some women may not realize is how beneficial even one drop of breast milk is. One drop includes water, proteins, lactose, essential fatty acids, antibodies, hormones and growth factors, stem cells. It includes 800 strains of bacteria, so it'll help the baby to be able to fight off sicknesses that the mom is exposed to just through the breast milk. And then I think it's really important to also teach you how to get breastfeeding off to a good start, and one of the first ways that you do that is to know the cues. So you would need to know the early cues, the baby smacking their lips and they're sucking on their hands, and then the second cue might be that they're rooting or turning their head and they're fidgeting and they might start to get fussy, and then the third one, which can sometimes at this stage it can make it hard to get the baby to latch, is they are moving their head quickly and they are crying really hard. And so in that case, you would need to calm down the baby enough to be able to get him to latch onto the breast. And then how do you know if the baby's getting enough? They're going to have they're going to be eating 6 to 8 times a day, and your breasts are going to feel softer and less full after each feeding. The baby will have good skin color. They will be alert when awake, and they will have 6 wet diapers per day, along with a couple other things. And how will you know that they have a good latch? You can see the tongue if you pulled up their bottom lip on the nipples, or sorry, if you pulled it down a little bit, you'd be able to see the tongue And then their jaw has a circular motion when they are sucking. There's not clicking or any smacking sounds, along with a few other things. Now, let's go over storage of breast milk, because there will be times when you might want to have a break from baby. And so when it comes to storing of breast milk, it's important to think about how often will you be needing to do it. And are you going to need a pump, or is hand expressing enough? So if you're going to need a pump, then it's good to think about how often will you be using it? Will you need to pump quickly, and how easy it to clean and take with you? How is the suction on the machine? Is it adjustable to your needs? And do you have the correct breast shield size? All of these questions will help you determine if what kind of pump that you would need, and if you don't need a pump, that you would be needing to hand express, and then we can go over that in just a minute. Also, if you're going to be pumping, it would be helpful to know a few ways to increase your pumping efficiency. So one way is to pump for 2 to 5 minutes after after you don't see milk coming out anymore, and also to massage the breast and compress it as it's pumping. Another way is to eat the immunogogues, the foods that increase the milk supply. It also helps to apply a warm cloth and to have a picture of your baby nearby. So let's say you're at work, or you're just away for a little bit and you need to pump. It helps to have your baby's picture, so that it releases those good hormones. And then for storing, then I have the handout, and so I don't really feel like I need to go over the storage too much of it, because this will be the best way, and you'll be taking these with you today so that you can be prepared for it. And so that's about pumping. And then for the expressing with your hand, I'm not gonna show you on my actual breast completely, but I will send you a video. But it's you take your hand back, and then you kind of pinch, and then you roll it forward, and that is how you get the most out of hand expressing. And so then you can express it into a cup, and then put it into a bag for storage, or express it into a bottle, or whatever you feel that you need. And if you have any other questions, then feel free to call me or text me. I'm always available. Bye.